Hi, welcome to another episode of Hair Talks. I'm Dr. Joshua Chong, and today we'll be speaking about So what is Regenera Activa? Regenera Activa is actually a treatment that helps with cell signaling of the hair follicles to treat male and female pattern hair loss by thickening up already weakened hairs, or what we call miniaturized hairs. It is a regenerative medicine technique that uses this machine to produce micrografts that help to stimulate hair growth. Through my encounters with patients at Terra Medical who are generally disappointed by their Regenera results, I've identified 5 main reasons as to why that could be the case. So first up, wrong patient selection. So what I mean by wrong patient selection is probably diagnosing a patient inaccurately as having male or female pattern hair loss when truly the diagnosis was telogen effluvium or chronic telogen effluvium, or had some nutritional deficiency contributing to that. Sometimes Regenera Activa is also done on patients who have 2 extreme ends of balding and they're not going to be benefiting from this procedure. So generally when I screen my patients for suitability for this procedure, it will not only involve just looking at their hair, combing through their hair, but also using a video trichoscopy device which actually measures the diameter of their hairs to make sure that there are actually miniaturized hairs that can benefit from this reversal of miniaturization that Regenera does. If you skip this step, you actually may be misdiagnosing the condition and may not be getting an adequate result. The second most common reason I've seen is people using unorthodox techniques. Patients have come and told me that clinics have offered to do 5 or 6 or even 7 punch biopsies to achieve that tissue sample. Now the Regenera con cannot process that much tissue. There's no way that 6 pieces of tissue is going to benefit you more than 3 or 4 pieces of tissue. The worst bit is that they are told by these doctors that their balding is so diffuse and so advanced that they actually need more samples and more cells to achieve the same result in just one sitting. What's worse is that patients are being charged double for results that are clearly lacking. Doctors who have performed the procedure not according to the actual protocol have also caused quite bad scarring over the donor area, and also injection points sometimes get infected if not done in a sterile operating room environment. Thirdly, in certain cases, I would say that there is not a lack of results, but the expectations of the patients were not managed very well. Now Regenera, just like other regenerative technologies, have a limit to how much hair they can actually regenerate. Usually, this number is quoted as about a rough 30 to 40% increase in hair density in about 6 months. Some people have been promised the sky, and even though they do see some thickening and less shedding, they're still not happy with the results because it wasn't communicated to them earlier. Interestingly enough, I also hear of practitioners of Regenera Activa injecting the micrographs too far forward in the hairline, trying to elicit a hairline lowering response. Now that is the domain of hair transplant surgery, and we're never going to expect the result from Regenera in such cases. So we've spoken about wrong patient selection, unorthodox techniques, and unmanaged expectations. And the fourth factor would be that of a wrong biological target. What I mean by that is there are many different pathways of causing male pattern hair loss. Using the wingless integrin pathway of cell regeneration is just hitting one of the biological targets that are available. Sometimes we need to hit more than just one biological target. For example, we need to block the androgen receptor or reduce the amount of androgens that are circulating, or increase the blood vessel size or diameter to elicit that hair growth response in our patients. Which leads me to point 5, which is not using combination therapies. Regenera Activa as a standalone treatment has about a 70-80% chance of success. When you use that in combination with traditional formulations of treating hair loss such as medications, low-level laser light therapy, or even a hair transplant surgery, we tend to get better, more robust results. There are probably a bunch of other things that could go wrong with a Regenera Activa procedure, but if you are considering a Regenera Activa procedure to treat your hair loss, do keep these 5 points in mind and speak to your physician about your concerns before moving ahead. And if you're interested in how Terra Medical performs its Regenera Activa procedures, please click the link in the description box below.